If you have back pain literally right in here on either side, I'm going to show you how to fix it today. I'm going to give you 3 exercises, but most importantly, it's the strategy of the exercises that will help you understand what's going on and help you get some relief. I'm John from the Anatomy of Therapy. Let's figure this thing out. Now, this is the kind of pain that you actually feel in your back, those 2 little bumps at the small of your back. That is kind of where you will feel it. Now, the pain can kind of go up into the musculature of the low back, and it can start to shoot down into the glutes of the low back just a little bit, but mostly it's pretty centered. It might be a little bit more left, might be a little bit more right, but it's right there in the middle. Now, that sort of pain will also be tender or kind of triggered if you're to bend over, bend forward, or if you're to arch up, like if you're getting up from a seated position, or perhaps you've been seated too long and you just kind of uncomfortable, have to shimmy a little bit. It's just better if you stand up and move. But this is a very general pain. It's not always killing you, it's not crippling, but you know that it's there. Now, before I show you how to get some relief, I need to explain exactly what is going on here and why your back is not getting better. Now, usually people with this pain will try to stretch the back, maybe even the hips. Perhaps you've even tried a clamshell or a glute bridge, and that could work a bit, but those stretches and exercises don't work for 2 reasons. Reason 1, the dose. On the teeter-totter of health, you have more pain than remedy. So basically, people don't do enough reps to actually make a change in the body. And 2, it's not targeting the actual problem. Because I've seen these exercises work, it's just that they're not the right tool for the job. Perhaps it's not that they're bad exercise, but they're just addressing the wrong problem. Let me give you a better problem to solve. Here, I'll explain. Well, this is the kind of pain that usually people will try to stretch their back, and stretching the back might feel good for a second because it is trying to get the back muscles to relax, and that usually feels nice, but it's only for a second and it only kind of relieves it intermittently, let's just say. You may have also tried some glute stretches like a pigeon or a figure 4 where you cross your leg over and they all kind of feel good as well. Maybe you've even tried glute strengthening, like a clamshell or a monster walk to strengthen up your glutes because you've been told that it's not the back, it's the hip. Well, it is the hips, but you just need to think about it just a little. Now, before I get to explaining and showing you these 3 exercises, plus the strategy on top of it, dose. The first time you did these exercises, most likely the dose in terms of pain versus the remedy, you had more of a problem than you had more of a remedy, right? So you need to give enough medicine to match the problem. You didn't do enough reps to make a long and lasting change. See, that area where you can actually feel the pain in your low back is actually where the glute max and the glute med start to insert in your pelvis, okay? So we need to know the difference between the glute max and the glute med. We also need to know the difference of our pelvis versus the femurs. So let me explain exactly how all this works. It's not really about glute strength, it's about glute control, because if you can learn to control your pelvis, you can control your back pain. Control the hips and you can control your back pain. Now, you still need to stack this with the strategy I'm going to talk about at the very end to make sure that this works, strategy stacking, but let me help you understand how to control your pelvis. Glute max, glute med, pelvis, femurs. I'm gonna lay it all out for you. I will now use these 3 exercises to explain exactly what I'm talking about. If you have that pain that you feel right in the small of your back, you're going to be bad at one of these, perhaps multiple ones of these. If you can find the one that you're not good at and become better at it, you can begin to fix and control the way that you use your hips, control the hips, control the back. Okay, so let's go over some of those variations. Again, pay attention and try these. Find the one that you're not good at. There'll be some there will be some that seem very easy, and there will be some that will be more challenging. Find the ones that are challenging and make them easy, and you'll notice a massive change in the way that your back feels. Okay, here we go. Let's try it. Option number 1. This is the hip airplane, option 1. You're gonna put your hands on a table or a chair. You're gonna put one leg out, bend the other leg, and extend the other leg back. Now what we're doing here is this femur is gonna stay still. You're gonna try to keep your pelvis facing down towards the ground. And then with this back leg, you'll see my foot turn back and forth. So what we wanna do is try to keep the pelvis still and just move the foot. Sometimes you'll feel the hip come up, or you won't be able to keep it down, but you just want to be able to move the foot back and forth, turning the femur back and forth on a stable pelvis. And if you can do that, great. Now, as I was doing it, I felt the down leg, this leg, I felt the glute working on this side. That's also good. Level 2 for the hip airplanes will be the same position, leg down, and then you're gonna keep your foot still. You're gonna try to open up the pelvis. Do you see my hips turning up? And then the hips are gonna turn down. Now you can use your hands to balance as much as you can so you can focus on lifting the hip up. You'll see the foot is staying still and stable. And then we're gonna bring the pelvis down. Now this is testing to see if your hips are stable, if they can twist back, if they can twist forth. Now, what usually happens in that spot where you start to feel the pain is that the pelvis becomes unstable and it jams up into the back. So if you can learn to control your hips, you can control your back. So the hip airplane is a little bit tricky to do. You may feel a little bit awkward as you begin to try to move just your foot back and forth or just the hip back and forth. One of those will be challenging. Now, the trick is actually you're moving things on the open chain, but the foot that's down on the ground, the closed chain, you'll also begin to feel work there, hopefully. Use your hands to balance as much as you can. Go slow and see how long you can go, because there'll be a period where you begin to burn out. The burnout is good. We are looking for the burnout. There's this thing called muscle analgesia, where if you can get enough burn in the muscles, it's the body's natural way. It's the body's natural painkiller, muscle analgesia. You know how you work? You know how if you work out, you feel better? Well, if you can isolate muscle and movement and get a good burn in there, it creates and releases a bunch of hormones that actually just make you feel better. So it will feel good for a time, which is great, because that'll help you keep doing it and get better at it and get better at it each day. Okay, let's go to option 2. Again, I still need to explain the stack at the end, but let's go to option 2. In option 1, we checked if your hip can move back and forth this direction. Now we need to see if it can move back and forth this way. Same ideas, pelvis and femur moving on each other, one doing the other, one doing one movement, one doing the other. Now this time we're gonna see, again, if you can move back and forth. Okay, watch this. Okay, so for the second exercise, you're gonna, again, put your hands on something to hold yourself up, a table, the back of a chair, just something to get some support. This is not a balancing exercise for your upper body or your inner ear. This is a balancing exercise for your hips. So you're gonna take an athletic stance, so bend one knee, try to keep your weight even on the heel to the forefoot, maybe a little bit more on the heel, less on the forefoot. And what you're gonna do is kick one leg back. Now, here we're gonna do a pelvic tilt. And a pelvic tilt is just arching here to there. Pelvic tilt. Easy to do with both feet down, but we're going to challenge it in 2 ways. Again, find which one is the worst for you. So we'll put one foot back out. So we're gonna try to be here, bend knee, and then keep the leg back, okay? In this one, you're gonna try to tilt the pelvis forward, or this way would be forward, and this way would be back as this leg stays back, okay? Now again, I feel a lot of work on the down leg, but I wanna see, it's gonna be very hard to just move your pelvis there. It might be easier if you bring your knee here and you shift your hips back and forth, and then again, you wanna try it on the other leg. So put the other leg down. I would start with your leg forward, bend here, and then you're just gonna arch and twist. Again, this position is usually easier. You might feel a little bit of a strain in your low back. If it doesn't begin to hurt too bad, you might feel it a little bit, that's okay. After a couple reps, you should begin to feel it in that hip as you twist, arching back and forth. Again, leg forward should be easier. Leg backward, a little bit tougher. Here's a little bonus tip for this one. If as you are going and tilting your hips, you feel a certain point, it's not really about tilting one way there or one way back. As you tilt, there will be some position of tilt where you feel the most contraction in your glute. If you can find that position, hold that position, okay? So for me, it's right there. And I want to kind of get away from it. So this is gonna be your glute medius here. That's where I feel it. You might feel it more in the glute max. This is your glute medius. Hold that position. It's gonna be a position that you're not gonna want to hold, but you need to hold that position. You need to strengthen that position. Is it harder leg backwards, leg forward as you tilt, leg forward, tilt leg backwards, and then super secret bonus, find a position of tilt that is the hardest to hold somewhere through that dial of the hip, it's going to be challenging. Find it, hold it, feel better. Okay, option 3. So option 3 is going to be my favorite version of the glute bridge. It is going to combine the first 2 movements we did all into one. So a normal glute bridge, you put your feet on the wall at about a 90-degree angle, you lift up your hips just a little bit. Now as you do that, you should feel your back pushing down into the ground. Fun tip, try to relax your abs as you do this, okay? Don't tense your abs up too much. Try to let them go. As you do so, you should hopefully begin to feel your hamstrings working, okay? So our feet are nice and easy. We're not digging our heels in. We're just pushing our feet into the wall, relaxing our hips after we've lifted up our pelvis, and relaxing the abs, okay? We got a little hamstring. Now we've just got a little bit of a posterior tilt here. We've not done anything with the femurs, okay? So we need to do like we were doing with the first 2 exercises, except we're going to try to do one leg at a time. You'll see my legs are even. Here we're going to move one forward and then one back, okay? Now we're going to keep this leg still, and then we're going to move this leg forward and this leg back. Now this is going to be challenging. Again, you want to find the one that challenges you the most, and then get better at that one, because that's going to make the biggest difference. So find the one that you're the worst at with these, and that'll really make the biggest difference. Okay, so keep this leg still, keep the left leg still, move the right leg up and right leg down. Common errors are you're going to go up on your toe. Here we don't want that. We want the movement to come from the hip so that the pelvis goes up, the pelvis goes down. You can go a little bit on your toe, it's okay if you need to kind of figure out that movement, how that feels. And then you're going to try to pull that down and back without really touching the ground. So my hips are staying elevated the whole time. They're not coming up. You can see my hand there. And then we're just going to move this up and down. Going to try to keep our legs parallel. And we're going to do the same thing with the other side. Keep this leg still, move up, then pull it back down, move up, pull it back down. You can see my legs are parallel. There's not a lot of shifting in my hips. When you first try this, it's going to feel very awkward. You're going to find it's harder to go forward, harder to go back on the right leg, harder to go forward on the left, or harder to go back on the left, okay? Those are the major patterns. Now, there is, of course, another pattern of being able to do the same thing, and this is the ultimate. If you can get to this level, your back will feel amazing, okay? So what we want to do is get one leg to go forward and the other leg to go back at the same time, and then we're going to switch, back and forth. So each leg is doing each thing, but at the same time and on the opposite side, okay? It's a really tough one to get, but as I said, if you can do this, this is going to take away that nasty pain that you feel kind of in the low back. It's going to take some time to work on this, but if you can do it, I highly suggest it. Now, that strategy I was talking about at the end, let me tell you what I'm talking about. Okay, so what you need to do is find the one that you are worst at. Do the first 2, the hip airplane and the wall tilt, okay? Those 2 are a little bit easier than the last one, but try to put them all together in the final one and really see if you can work femur, pelvis, pelvis, femur, glute max, glute med. Find the one that's the worst and do that over and over again until it becomes easy. If you're the type of person though that needs a full program, we have those linked below with these exact same principles, just a proper program on how to work and correct your pelvis and your back. We have 2 programs, the anterior pelvic tilt program, which I suggest most people start with. If you have a tilted or shifty hip situation and this stuff started to benefit you, get Series 1, Foundations. They're both excellent. They're both full programs. They deal with the same principles we talked about today, but they just lay it out exactly what to do day by day, step by step. If you don't want to do that, just find the one that you're worst at here today and work on that one thing. If you can make an improvement there, you can make an improvement anywhere. Thank you for listening to tuning in, watching me. If you guys have questions, leave comments below, like, subscribe, do all of those things, I think. We have a podcast. There's probably a link to that below as well. Thanks so much. Y'all have a great day.